Hi from healthvideos A-Z.com in Bali and Singapore. People who are sluggish, overweight, depressed and feel the cold severely may have a shortage of T3 thyroid hormone in their cells, and dieting, antidepressants and warm clothes may not help much unless their cell T3 is corrected. A part of our brain controls our pituitary gland in the base of our brain. The pituitary gland produces thyroid-stimulating hormone, TSH. TSH controls the thyroid gland in the front of our neck, which produces T3 and T4 hormones. T3 and T4 flow in our blood to every cell in our body where T4 is converted to T3, which is what does the work of the thyroid gland. Measuring cell T3 is very costly, and we thought blood tests were good enough, but now know sometimes cell T3 is too low, even when the blood tests are normal. So the only way to know whether someone's cell T3 is normal is to ask them how they feel, then look for abnormal signs. The signs of not enough T3 in your cells include sluggishness, tiredness, feeling much colder than most other people feel, depression with loss of interest and irritability, a foggy mind and a poor memory, excessive weight gain that dieting doesn't help, high cholesterol, blood sugar, and sometimes diabetes, dry, itchy skin, hair loss, muscle weakness, aches, cramps, or fibromyalgia, a swelling in the front of the neck, indigestion or constipation, premenstrual tension or irregular menstruation. The signs of too much T3 in your cells include feeling hotter and sweatier than most other people feel, anxiety, restlessness, overactivity, agitation, poor sleep, irritability and moodiness, a racing or irregular pulse and heartbeat, trembling hands or fingers, tiredness and weakness, poor concentration, loss of weight without increased eating or with increased eating, abnormally prominent eyes, a swelling in the front of the neck, thin skin and weak hair, loose bowels, light or no menstruation. If you have signs of possible thyroid under or overactivity, in 10 minutes do the What I Want Need checklist at healthvideos A-Z.com. Then watch the videos that the checklist instant report advisors will most help you based on the wants needs for which you chose high scores. Then show that report to a doctor, have a general examination and a thyroid ultrasound and blood glucose, cholesterol, thyroid, vitamins D and B12, magnesium tests, and get any abnormalities corrected, but don't assume that near normal thyroid blood tests mean your cell T3 is normal. Get the LDN book and read the thyroid chapters, then talk to your doctor about a trial course of LDN, low-dose naltrexone, to correct any thyroid autoimmune damage, which is the commonest cause of thyroid disease. If after 2 months on LDN your feelings, functioning and signs suggest you're still low in thyroid, discuss with your doctor taking small amounts of T3 and increasing it very slowly. If you take T3, weigh yourself often, notice any changes in how you are, and check regularly with your doctor and family and friends whether they notice any changes. If on T3 you feel better and your signs of thyroid deficiency reduce, but then you start to have feelings and signs of too much thyroid, activity, adjust the dose a little each week until you're on the right amount. Or if after 2 months on LDN, your feelings, functioning signs still suggest too much thyroid T3, talk to your doctor about the medicine that suppresses thyroid overactivity. Please watch this video several times and go to its text at healthvideos.com and click on links of interest. If possible, spend 10 minutes now at healthvideos.com doing the What I Want Need checklist. The checklist instant report explains which videos, medicines, and counseling therapy most help the particular wants and needs for which you chose the highest scores. healthvideos@gmail.com have contact details for suppliers of low-priced pocket powder medicine dispensers worldwide. From international Bali and Singapore, I'm keen to pass on helpful information to distressed people and their carers anywhere in the world. Please leave comments and questions below. Best wishes and good luck from healthvideos.com and the Fix Suffering Early, Simply and Safely system.